Research conducted by the World Health Organization concluded that depression is the leading cause of disease burden and disability in the U.S. today. Since the early 90s, the incidence of major depression in the U.S. has more than doubled, with devastating consequences for patients and their families. The STARDY study conducted by the National Institute of Health revealed that 73% of patients don't respond to the first antidepressant medication they try, and their chances of responding decrease with each new medication trial. In addition to this, the chances of patients discontinuing treatment increase with each new medication attempt. Unfortunately, this leaves many patients without hope for recovery. However, there is a new treatment option for patients with major depressive disorder called transcranial magnetic stimulation, or TMS. TMS is FDA approved, highly effective, clinically proven, and covered by most insurance. TMS is non-invasive, has virtually no side effects, it's very safe, and is drug-free. TMS treatments are delivered in-office and take only 19 minutes a day, 5 days a week, for 4 to 6 weeks. No sedation is required. Patients are awake and alert during therapy and return to normal activities immediately following the treatment session. TMS can be delivered alone or as an add-on therapy to antidepressant medication. TMS is a compelling treatment alternative for patients who haven't fully responded to medication, aren't satisfied with the results of current therapy, are suffering unwanted side effects of medication, need to reduce or discontinue medications such as in pregnancy or nursing, or are looking for a more natural treatment alternative. Note that there are 2 types of TMS equipment that have achieved FDA clearance. Please watch our video on TMS technology for more information about first and second generation TMS equipment. In the first double-blind, randomized, controlled, multi-center study evaluating the efficacy and safety of second-generation deep TMS equipment, participants were required to discontinue all antidepressant medication prior to TMS therapy. Over 75% of participants receiving only TMS therapy achieved a 50% or greater reduction in depression symptoms, and 36.6% achieved full remission from depression. In clinical practice, where patients can continue antidepressant medication, even higher response and remission rates are achieved. Although no studies have been conducted evaluating TMS as an add-on therapy, full remission rates greater than 50% have been reported. Here are 2 clinical cases that are representative of patients who respond to TMS therapy. Their response to treatment was measured using BDI-2 scores. Patient A first showed a decrease in depression symptoms during the end of the 2nd week of treatment, but did not reach a full and sustained remission of symptoms until the end of week 4, which was maintained through the 3-month post-treatment follow-up period. Patient B first experienced a decrease in depression symptoms during the 5th week of treatment. It was pushed to a full and sustained remission during the 6th week of treatment, which was maintained through the post-treatment follow-up period. TMS is very safe and has no serious side effects. Some patients experience transient headaches or scalp discomfort during treatment, which usually passes within the 1st week of therapy, and most patients find that over-the-counter pain medication is effective in resolving these symptoms. There is a very small possibility of seizure during TMS treatment. However, the incidence of seizure is less than 0.2%, which is very similar to the risk of seizure from antidepressant medication alone. There are no known long-term adverse effects from TMS therapy. An American Psychiatric Association analysis of aggregate safety data from more than 10,000 treatment sessions with 325 patients treated at 23 clinical sites in the US, Canada, and Australia showed that TMS was well tolerated, with less than 5% of subjects leaving the study due to adverse effects, and no seizures were observed. The most common adverse effects were transient headaches or scalp discomfort. Overall, the side effects were mild to moderate in intensity and dissipated over the initial week of treatment. In review, TMS is a compelling new treatment option for major depression that is FDA approved, highly effective, clinically proven, and covered by insurance. It's very safe, drug-free, non-invasive, and has virtually no side effects. Links to reference materials and sources are provided at the bottom of this website. Thank you for your time.